Good evening, everyone. I wanted to do a video log tonight on what it's like to be a healthcare professional working in the US and Canadian medical models. I've been practicing for over 10 years. My very first year, I was still in graduate school in Florida. Then I practiced for a few years in New York City, and my last 5.5 years have been in Canada. Being that this is a huge topic, most likely I'm going to split this up over two, maybe even three sessions. We'll see how it goes. Um, my biggest challenge is working as a healthcare professional in the States is that it is highly expected of you. It doesn't matter if you're a doctor, if you're a physio, um, if you're an OT, if you're a dietitian. Doesn't matter. If you're an allied healthcare professional, it's expected of you to have really extremely high productivity numbers. In my profession, I worked 40 hours a week. In those 40 hours, I was the only specialist at a rehab place in Queens. I think it had 2 to 300 beds. I can't remember. I want to say closer to 300 beds. I worked there 20 hours a week. I covered a major hospital in Brooklyn that had 220 beds. I worked there roughly 16 hours a week. And then, just for good measure, I had two home care clients that were in my neighborhood because I wanted to keep my clinical skills up working with kids. So, between those three different places, I was extremely busy. When I was at the rehab place in Queens, my whole time there, I had students from grad school. So, I would have to kind of show them the ropes, supervise them, carry a caseload of 8 or 9 clients, um, do 3 to 4 swallowing assessments a day, do a screen on every single person that entered this facility. And on a slow day, there would be 2 or 3 people. On a busy day, there were 6 or 7. And I would have to do all this as well as answer to my boss in case if there's anything else that came my way. Um, Speak to families. That happened quite often. They want to know the progress of their loved one. And I had to do all this in 20 hours, which is completely crazy. Um, so usually I would go there early. Some days I would even get there before 7 a.m. because I knew that I would be able to see clients during breakfast time. So I could do my swallow evals then without being bothered. Once I would leave there, I would some days go back to my home neighborhood, see those little kitties. Um, on the other days, I would go straight to the hospital. And on a slow day at the hospital, I would have 4 or 5 consults. Usually, it would deal with someone that had a stroke or someone who lost the ability to swallow. On a fast day, I would have 9 or 10 consults. Some would be full blown evals, where it would be expected for me to assess um, how well they can communicate, how well they can eat, how well they can understand. And on those type of days, I would be there 5 or 6 hours. So by the time I would leave the hospital, it would be close to 10 o'clock, sometimes even 10:30 at night. And then because I was young and in my mid 20s, I would still go out, sometimes for a nightcap, sometimes for dinner, come home midnight, wake up, do it all over again. I have no idea where that energy came from. When I think back at that time period, it's quite stressful. Like I said, it was really expected of you to have high numbers. And if you didn't, you would hear about it. Not to mention, there would be times where I would hear from a representative from an insurance company, or I would hear from my boss that would say, so and so needs to have a report. And in the US, if someone needs a report, it means they need a report yesterday. So you would have to drop everything that you're doing, write the report no later than the end of the business day and have it faxed. Um, I don't miss the hustle and bustle of that pace. It really stressed me out a lot. I really burnt out. But on the other hand, both Like all the places I worked at in New York City, I got along with pretty much everyone. I personally didn't have any drama. Obviously, workplaces do have drama, but I think I was running around with my head cut off. I didn't have time to get involved in any nonsense. I liked the fact that I saw a variety of diagnoses, and you do kind of have this sense of accomplishment that you're able to do all these things, almost unrealistic expectations, but I was able to manage it for years. Working in Canada is a bit different. The medical model is a bit different. Contrary to what most people believe, Canadians do pay for their health care. Um, in most provinces, it comes out of their taxes. In British Columbia, where I live, you actually have to pay for it yourself. If your company doesn't pay for it, it costs about $65 for an individual, $120 for a family. I know these numbers seem high for Canadians, but for US or Americans, it's quite low. But being that everybody pays and everybody's covered, the system here is that you're going to have to wait for services. Now, in my field, the model is we don't base the wait time on severity. We base it on when you get a referral. So the earlier you are aware of your condition or your child's condition, the faster you might be seen. Um, it's expected of me here to see 4 or 5 clients a day. If there's some questions or someone needs a report, the expectation is I have 3 weeks, maybe even a month to do it. Um, I like working for the Canadian system in the sense that I feel that there's more of an emphasis on quality of care. There's more of an emphasis on me wanting to be the best therapist that I can. So a lot of employers, if they're big, will invest some money in making sure that all of their allied healthcare professionals are going to conferences, um, knowing more about what's the evidence based practices out there. When I worked in New York City, I can't speak for all of the US, but at least in New York City, it was more about productivity and money, 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 and how much we can make. It wasn't so much focused on the quality of care. That's not to say that the quality of care in the US is poor. It's actually pretty good. And in my personal opinion, if I really do have to pick between um, being cared for by a US doctor and being cared for by a Canadian doctor, 9 times out of 10, I would go with the US doctor if I had health insurance. But we all know that most people don't have health insurance. So, anyway, that's my thoughts. I do want to talk about next time my experience of being a patient in the US system and the Canadian system. I already just told you that I prefer the US care model if you have healthcare insurance. But being that most people don't, I do appreciate the fact that the Canadian model exists. And I like the fact, like I said, that even though people here do have to wait, I have seen a lot of quality care being provided. And so I'm just going to end on this note, which is regardless of which country you live in, next time you have to go see your doctor or next time you go see a healthcare professional, that, just keep in mind of the workload that they have and just be thankful that you're working with someone who's taking the time out to work with you in your day-to-day life. And on that note, I'll say good night. Bye.